Where'd you phone there? Okay, I've got the theme on this one. Okay, let's get down to business. So we're gonna go over some anatomy, osteology, and arthrology. All three terms should sound very familiar, guys. What is osteology? And what is arthrology? And of course, skeletal anatomy is going to be all those wonderful landmarks, all those words. Who can name a few of those landmarks just off the top of their head from last semester that we talked about? Where's some of those bony landmarks?
Iliac crest.
Seesaw.
Yeah, all correct, all correct. But things like your trochanters, your tubercles, remember those words? Your fossa, all that wonderful stuff? No. Oh, we better go back and review because that's coming back full circle. It's coming back with 200% speed right your way to a theater near you. Rated R. See it Friday. But anyway.
Rated R
My jokes just aren't landing today. Anyway, it's essential, guys, because everything we're talking about this semester is bony anatomy. We're not doing any organs this semester. We did focus on a lot of organs last semester. That's going to come back in Rad Pro 4. We're going to revisit all those organs, but now we're 100% engrossed in bony anatomy. So that's your tubercles, your fossa, your epicondyles, your trochanters, your processes, all those words we reviewed. We've got to master those because that's all going to be on the anatomy we start learning. So, once again, guys, important number right there. I hope we haven't forgotten that. When we talk about the entire amount of bones in the adult skeleton, that equals to 206. You guys did just define osteology and arthrology. That's very important because we're going to be talking about a lot of joints this semester as well. Throughout the entire appendicular skeleton, there are dozens of joints that we have to learn, and they fall within those categories we discussed last semester. If you remember, they were categorized by name and movement. Just a couple off the top of your head. Do y'all remember what they were? Some different joints we talked about. Synovial joints. What else? Pivot joints, your ellipsoid joints, your ball and socket joints, hinge. That's we're going to be talking about all those moving forward. Yeah, socket was something. Ball and socket. Yes.
Ball and socket.
That's very important because as we learn each area of the skeleton, guys, we're going to classify all the joints within that area of the skeleton. So just in the upper extremities, for example, we have about 5 categories all those joints can fall under. And you have to learn what categories those are specifically. Oh, by the way, just fun fact there, I don't know if we hit this last semester, but at birth, this number does vary by text, but on average, you have about 300 bones at birth. Now, why do you have so much more as a baby compared to an adult? Because they haven't, as you said, fused. They have not fused yet. So you will have a lot more bones as a baby compared to when you're an adult, when those bones are fusing together to make the entire bones. So they're all separated at birth by cartilage, as we know. And when they form together, they ossify, and they form, what was that word? When they ossify together, they form a what?
Zero plate.
A growth plate, growth plates, or epiphyseal. Epiphyseal plate. Can't say either this one. Epiphyseal plate, correct. Correct. All right, so some more numbers to review here, guys. When we talk about the axial skeleton by itself, we are talking about 80 bones on the axial skeleton. That's going to be the central axis of your body. And that most commonly is going to be composed of your skull, your vertebral column, your ribs, and your sternum. That's your axial skeleton, which is just right down the middle of the body. But we're not really focused on this semester. This will be next semester, by the way. We're going to be focused on that appendicular skeleton, which is going to be the limbs, the upper and lower limbs specifically. Watch it make all kinds of noise. I got a new phone, so everything's been reconnecting and acting crazy.
Are you still Team Android?
Oh, 100%. I waste my time on my Apple products.
Boo.
Sorry, Apple people. You know, you're paying for the brand, not the quality. I'm just going to say it.
I'll text you the green.
What do you
I have an Android. It's the Samsung Galaxy S22 Ultra. It's like the
Sounds
sequel
cool,
to the
dude.
young phone.
Is it the one that
I have an iPhone. I understand.
It's not that one. This is their most powerful
I
one.
want to do a flip phone.
Is it the one that has
Of
like?
course, it takes pictures in 5K. by
Does
the way.
it like fold?
Huh? This one doesn't fold. No.
Is it the one with
I don't
the-
trust that technology yet. I don't think it's evolved quite enough yet. It's still prototyped, in my opinion. So. Anyway, enough about phones. Back on schedule here, guys. Of course, what are we focused on this semester? Once again, appendicular. That's what you see highlighted in blue. 126 bones total in your appendicular skeleton. And once again, that's your upper and lower limbs and your shoulder and pelvic girdles. So you're using your appendicular skeleton to write notes right now with your phalanges or your digits or your 4 fingers and 1 thumb, right? Remember that? Did you blow your family's mind when you said that over the break? Anybody? They argue with you? Oh, yes. All right, so there's that bony composition once again, guys. We're just going to briefly review that as well. I'm sorry my watch is making noise. Of course, the main components there, guys, there are more than just these 6, but these are the main components we're going to focus on. Your compact bone, your spongy or cancellous bone. We're going to break these down individually again once we go through the slide. Your body, medullary cavity, periosteum, and your articular cartilage. It's your 6 main components of bony composition. What we see right here is an example of a long bone. Y'all do remember there are categories of bones. We're going to hit those as well. So your compact bone, guys, once again, that's your outer layer. That's that hard outer surface that keeps that bone nice and strong, protect against impact, so hopefully it doesn't fracture or break. Within that compact bone is that spongy or cancellous bone, and that's what contains your red marrow. Very porous. If you cut the bone open, there's like little holes all through the bone. Then the body is going to be the main shaft of a long bone. This entire area is the body. Your periosteum, if you remember, that is that little thin sheath that goes around the bone, almost like a little piece of wrapping paper around it. It serves as an attachment point for your arteries and your nutrients going into the bone. It's a little attachment point. Then your articular cartilage, sometimes referred to as hyaline cartilage. At the ends of most of your long bones is articular cartilage to kind of create like a pillow or a little spongy area, like a little soft area for impact so that you don't wear those bones down through erosion. Now, a lot of you probably know family members that have had cartilage that has degraded, and it causes them a lot of joint pain. They get very stiff. That cartilage is there to help pillow that area and creates less erosion as we move those body parts around. And that cartilage degrades with age, those bones will start rubbing against each other, and they'll start eroding each other. So a great example, like ball and socket joint, the proximal humerus fitting into the shoulder, there's cartilage there to create like a little cushion as I move that joint around. But as I age and that cartilage starts to wear away, those bones are actually directly on top of each other, and as I'm moving it around, it's wearing that bone down, bone against bone. We don't want that. So a lot of people come into radiology for what we call arthrograms. You'll see that possibly this week if you're in fluoro. In arthrograms, they'll inject contrast into that joint space to check the integrity of that cartilage and see if they need some kind of surgery to create more padding in there for those specific joint spaces. So that's something we're very heavily involved with in X-ray, are those joint exams called arthrograms. We do them on a daily basis. So some of your family members may have had that done, where they have the contrast injected to check the cartilage. They're checking the integrity of that cartilage around that joint. So once again, like I said, see if they need surgery to add some of that padding in there, artificial cartilage to help lessen that erosion of the bones against bones as we move around. Wear and tear of the body. Most commonly it's going in your knees. You want to know what some bad knee joint pain? That cartilage wears on the knees really bad. And as you have more weight on your body, it starts to degrade that cartilage faster as well. Okay, so there's the full definition of that compact bone there. Once again, that's that outer surface right there on the bone. The hard external layer of all bones surrounds that medullary cavity within the middle, or that bone marrow. Its main function is to provide protection and strength to your bones. Protection and strength. Hard outer shell. Keywords there. Should all be review, but you will see some of this terminology pop up on your exams because we're going to keep recycling the information to keep it fresh. Now, what else does that compact bone? It's going to give you support and flexibility without the weight of compact bone. I'm sorry, rewind. This is compact bone. I missed a word here. This is for your spongy or cancellous bone right here. I didn't have the term on there. That's going to provide your structural support and flexibility. It's found in most areas of the bone that are not subject to great mechanical stress. Spongy bone.
Excuse me, sir.
Yes, ma'am.
So what does prove structural support mean?
Prove structural support, it just reinforces the support of the body. It's proven to work. Bad wording there on my part.
It
I
might have been
apologize.
provided.
Reinforcing structural
It's
support.
reinforcing the structure and support. Yeah. Okay, medullary cavity. It's going to be the central portion of that long bone. That's a hollow area in the center of the bone shaft, and that's going to contain your bone marrow. That's where that bone marrow is actually formed, inside the bone, that medullary cavity. For those of you going through surgery, you might get to actually see some actual bones inside the body, depending on what kind of surgery they're doing. We're heavily involved in multiple types of surgeries in radiology. So you're going to see lots of blood and guts, bones, all that wonderful, juicy stuff. If you're squeamish, don't worry, you get over it really quick. I used to be squeamish too. I got over it really quick. Yeah.
What bone is that? A human? Or
That's a humerus. Yes, it is.
I think I found one on a hike. It's
You
the-
found a humerus?
No, like that's the bone that I had sent in the group chat with my dog.
Human?
Yeah. Well, I don't know. He wasn't there to, stay. But I found like 6 bones on a hike by the Brazos River one time, and it looked very similar.
Probably should have
Probably, but
I should have reported that. But
hey, I saw it. And I was walking my dog, and I was like, "Hey, this is
He
cool."
gave his dog.
might be good to report that to
Your dog,
somebody.
your dog, here's some bones.
Homicide.
No, straight up. Like,
You gonna go
gave it
feed
straight to my
for a
dog.
couple days?
It just got really dark really quick. Found humans' remains. I just gave it to my dog.
they look like cow bones. I didn't think that they were huge, man.
Yeah.
Periosteum. There's that connective tissue enveloping the bone like wrapping paper once again, guys. That's going to be on every surface of the bone except for the surfaces of the joints, because the joints have the articular cartilage surrounding them. It's a vascular connective tissue, and the main function of periosteum is to provide a connection point for the blood vessels to allow those bones to get nutrients. Very thin sheath, like a little piece of wrapping paper or saran wrap. It's like saran wrap goes around the bone. So, yeah. Is that it? That looks bigger than a human. That looks
That's
like
what I was saying.
That's an animal. Like,
Yeah.
That's not human, unless it's like a freaking giant.
I don't know. I thought I
It might be Bigfoot.
found some fossils out there.
shocked.
All right, I'll forgive you this time for giving it to the dog. It doesn't look human. So.
They look like cow bones to me.
You grabbed it with your hand.
All right, and there's that articular cartilage once again, guys. It's going to be that smooth white tissue that's on the ends of your bone, primarily at the joint spaces, and that's going to cushion those bones from eroding each other at the joints. Smooth white tissue covering the ends of bones. They come together to form your joints. Yeah, speaking of surgery, that was my very first rotation when I was in X-ray school. I never forget it because it was so, it was just a culture shock for me, having grown up in a very protective home. I walked in the surgery room and they were doing a lithotripsy on a female patient. And they had her just butt naked on the table in the lithotomy position. And I walk in just like I had no idea what I was walking into. Like, oh my God, like this person's just sitting naked on the table, like, legs up in the air, and they're doing like an invasive surgery to look for kidney stones. It was quite a shock. Quite a shock.
I'm sure.
For me, it was. The home I grew up in, especially. You're gonna see all kinds of stuff. You're gonna learn really quickly. You know, sometimes ignorance is bliss, but you're gonna learn very quickly. There's no modesty in surgery. They just throw you up there butt naked, and no one thinks twice. And they're gonna talk about your body. They're gonna make comments about your body. It's very unfortunate, but it's true. You're gonna see what I mean. You're gonna see what I mean. They don't care in surgery.
The patient's knocked out.
Yeah.
Oh, the patient's out. Yeah.
So it doesn't.
Yeah.
They're not hearing it.
Man, once they're out, they strip you and then they start talking about you.
Oh, you say like out of the room? I thought you meant like in the table, like they're out like this. Man, y'all bullying them while they're asleep, bro? They can't even defend themselves.
They are. That's what he's talking about.
That's what they're talking about.
But the patient's like, yeah, and then it's like, damn, that's still a
I'm always going to act like the patient can hear.
Like I said, I can't wait to hear your stories as you acquire stories out tonight. You're gonna see some stuff, guys. You're gonna see some stuff. All right, let's just show you an example, guys, of that compact bone versus the spongy bone. It really looks like a sponge.
Yeah.
It's actually porous like that. It's to allow those vessels to go through the bone, deliver the nutrients, of course your marrow to travel as well. It can't be solid, otherwise it wouldn't be able to go anywhere.
It how does it like? Do the gaps facilitate the weight like difference or like force difference? Because
Depending on
it's
the bone,
super, it's super soft.
Depending on the bone, yeah, that's the purpose of that compact bone to provide that extra support.
Okay.
If you remove the compact bone, it probably just crumble on itself.
Yeah.
Just another example there, guys. Of course, your appendicular skeleton and the limbs. You guys okay with that? All right. Just making sure. There's your compact bone or your spongy bone once more. That's a femur that we're looking at on the left. There's that epiphyseal line. What is that once again?
The growth line.
That's your growth plate. It's fused together, or ossified is a scientific term, an ossification of the bones. By the way, fun fact, I think I already mentioned this, the femur is the largest and strongest bone in the body because it has to hold all that weight of your torso on it.
Oh, Jesus. I'm gonna pray for Mama.
That's a test question, by the way. The femur is the largest and strongest bone in the body. It's a registry question, actually. Which they're all that easy, but it's one of the easier ones.
The Adam, is that the website you pulled the image from, or is that just like
I think that's the
artist?
That's just the artist for that image, I believe. Which I'm not sure.
Because I know you sent like Radiopedia or whatever.
Radiopedia is a very good resource.
Okay.
There are not a lot of good resources that are reliable. Radiopedia is pretty accurate overall.
I checked the upper extremities pictures that they had over the break, and they had some of the X-rays of the hand like touching, like the two fingers touching. And I talked to
So
the
there's a
senior-
variance between textbooks on how that works. We're going to talk about both this semester, though. Not one or the other is necessarily wrong. They're just different techniques to do the same thing. Periosteum, that's showing you once again, guys, that periosteum real close. It's that thin sheath for those connection points for those vessels once again. It literally looks like a piece of saran wrap if you were to take it off the bone. And then that's some examples of that articular cartilage, the knee in particular, guys. That's what we see, that white area there. And what happens once again as people age, that cartilage starts to wear away. And then those bones are really touching each other as we move, like the knee. If you were to flex your knee, the bones are rubbing against each other. It can cause a lot of pain, a lot of stiffness in the joints. It can actually damage the bones quite severely. It can cripple people.
So is
Yeah.
that why a lot of older people get the knee replacement?
Yes.
Too? Okay.
Yes, they'll get the actual full knee replacement to supplement that area and help it have a little bit better function. You'll see a lot of those too. You know, whenever you go into surgery, I keep talking about surgery, you're going to do a lot of ortho cases. And that's the ones that are working on like the long bones, the appendicular skeleton. And it's always like a workshop. They're in there just hammering nails and people drilling screws in the bones. It's going to look like a workshop. It's going to sound like a workshop. You'll see like drills. It'll look like something out of the garage.
I've
bone
seen
saws,
one
bro.
before.
Oh my god.
Yeah.
The operation
Huh?
on a kid that they was doing a kid, and I think he dislocated his elbow, and like I say, they get them big tools and they was like boom,
Oh, yeah.
boom.
Oh, I saw that
I
on
was
TikTok or
like-
something.
Dude.
And the key was just not. It was like how they broke it.
What is the purpose of us being in there? Like, what, are we doing something? Like, are we gonna be in there doing?
You just hold up the wall and watch.
Oh.
No, not really. You actually are involved. You are
Oh,
involved.
it's like, after they hit it,
No, of
they
course,
have to
we,
make sure that
so
it's
guys,
raised.
if you don't realize, a lot of people don't realize how vital we are in surgery as a department. We are literally the eyes of the doctor for these orthos. Think about it. They try to do these orthos as non-invasive as possible. So they try to not make huge incisions unless they have to. They're gonna make a tiny incision and try to guide a small nail or screw into the bone. If they're doing that blind, they're not gonna be very successful. So if you got a bone that's fractured, like the humerus, they gotta drive a rod through the center of that humerus. You okay?
Yeah, I'm just.
They gotta drive a rod through the center of that humerus without puncturing the other side of it. They gotta go straight down the middle. If they're doing that blind, they're not gonna be successful. You're gonna have a C-arm. C-arm is basically a big mobile fluoro unit, and you're gonna be able to let them see internally from different angles if that rod's going correctly into the bone, or the screws are going in the right spot, things like that. So you're the eyes guiding them in these cases. All these surgeries with C-arms, you're literally the eyes for the doctor. So you're heavily involved in surgery cases, not just watching. We work in surgery all day long, all day long. So long cases, I've done 12-hour cases with doctors. I used to work 16-hour shifts. I was in there almost the entire shift on spinal surgeries, very long surgeries.
Does the gauge for the pin vary on the bone?
Yes, yes it does. And the severity of the fracture and the age of the patient.
Okay. So like, let's say someone needs a pin in their calcaneus system, and like they're a kid, it would be different for an adult.
It would be, yes. Yes, it would. All right, so let's go through those bone classifications. We have 4 main bone classifications: your long bones, your short bones, your flat, your irregular. That should sound like review to you because we did hit that last semester. We will be talking primarily this semester about the first 3, the long, the short, and the flat. Irregular typically does not show up until Rad Pro 3 because irregular bones will be your spine and bones in the face and skull because they're very unique. They don't share any designs or shapes with other bones in the body. Whereas your long, short, and flat, we got a lot of similarities between those bones. That's going to be the majority of your appendicular skeleton, the first 3 bullet points there. So what is a long bone? That's the ones involved with your large movements. They are actually elongated, thus being called long bones. They have greater length than width. This will be your humerus, your femurs, your tibia fibulas, your radius, your ulna. Yes, even your fingers are considered long bones because they have that same shape of varying lengths. They all have a characteristic of what we call knob-like ends. We call those epiphyses, review from last semester. And they are mostly spongy bone covered by that thin layer of compact bone we just looked at. Your atypical, most common bone shape, your stereotypical bone shape. When you see a dog with a bone in its mouth in a cartoon, they're basing it off of a long bone. Although none of those bones actually look like that in real life, as you probably have figured out by now. So once again, just remember the ends of the long bone are the epiphysis. The central portion where the body is what we call the diaphysis. It's another name for that. Diaphysis versus epiphysis. That is your most stereotypical bone shape right there. That's a good stopping point. Only got 3 minutes. We'll stop right there, guys. So we will finish up with the review portion on Friday, and then we'll start getting into our first chapter